Hey guys, hey, welcome to my YouTube channel. My name is Dr. Ipeleng. I am a specialist doctor in obstetrics and gynecology. So go ahead and click on subscribe, comment, like, and share this video with the women in your life, your sister, your mom, your friends. And as you can see from the title of the video, I am going to be talking about vaginal discharge. So vaginal discharge is a mixture of fluid, cells, and bacteria, and it helps to lubricate and protect the vagina. Talking of bacteria, the bacteria that we find in the vagina does not typically cause any issues. It does not cause disease. Contrary to this, it actually produces substances such as lactic acid and hydrogen peroxide, which helps to protect the vagina. It is not always related to an underlying condition, and its consistency and color can differ depending on where you are on your menstrual cycle, and it can also differ depending on your age, whether you are on your reproductive age or a neonate or puberty or menopause, right? So talking of normal vaginal discharge, we can have the clear watery vaginal discharge, which we find around ovulation or when somebody is sexually aroused. That is the kind of discharge that we expect. And then we have the white discharge, which we will see around menstruation, before menstruation or after at the beginning of menstruation or after. You will see the white thick discharge, which is kind of sticky. And then we have the clear mucus-like discharge, which we see around ovulation, which can be an indication that you are ovulating. And the other one, you can have like the brownish or bloody discharge just before menstruation, or when you are completing your menstruation or your period, you will see like some brownish bloody discharge, which is very normal. But if you are having bloody discharge or spotting at the time when you are supposed to be having your period, not just at the start, but at the time when you're supposed to be having your period, then you might be pregnant. That could be an indication of implantation bleeding, which is usually just spotting. So yes, another normal color of vaginal discharge that I must mention is the yellowish discharge, is the yellowish color, because when the normal vaginal discharge is exposed to sunlight, it can change its color to yellow or yellowish green. So let's talk about abnormal vaginal discharge. Abnormal vaginal discharge can occur in a number of conditions, such as infections, imbalances in the pH or vaginal flora, and sometimes there is no known cause. So if you see some of these associated symptoms, it is time for you to see your healthcare provider, because it is important that you treat any infection as early as possible, because trying to treat it on your own again can lead to the condition worsening or the infection worsening. And there's a lot of risks associated with infections, really. Even though they could just be in the vagina, there's a possibility that they can go up and then cause what we call PID, pelvic inflammatory disease, and then later on occluding, blocking the tubes and leading to stuff such as infertility, things such as infertility. So it's important that whatever it is, that you go and get it checked and get treated as soon as possible. I am going to mention some of, or rather the most important or the most common conditions associated with abnormal vaginal discharge. And the first one being bacterial vaginosis. Bacterial vaginosis is not an STI. This is an infection that is caused by imbalance in the vaginal flora. And what happens is the main bacteria which we find in the vagina, the lactobacilli, it decreases, and then the number of the one bacteria, anaerobic bacteria, the main one being Gardnerella vaginalis, it increases, it goes up, and leads to bacterial vaginosis. So the discharge has a characteristic strong fishy odor, which is caused by the increase in anaerobic bacteria, as I have mentioned. So that typical fishy odor is most of the time in bacterial vaginosis, if not all of the time. And it is usually thin and gray, and it also kind of green sometimes, the discharge in the bacterial vaginosis. So if you see something like that, I'm gonna put a picture up here. Go and see your doctor. What are some of the symptoms? It's very rare to have itching and bacterial vaginosis, but most of the time you will definitely have burning during urination. When you pee, there will be some burning sensation. The exact reasons for the disruption of the bacteria or of the vaginal flora is usually unknown, but most of the time it's caused by antibiotics, unprotected sex, and douching. You know, all the stuff that people put up these days, like, oh yeah, this is what you can use for douching and it's necessary, it's important. It can actually lead to bacterial vaginosis, so be very careful when you buy those stuff out there. And yeah, so let's go to the second main cause of vaginal discharge: yeast infection, which is also known as Candida albicans. So vaginal candidiasis is common in people who are immunocompromised. If you have the HIV and you are not on treatment, you will be immunocompromised, and most of the time, if not all the times, you will see that by somebody having the Candida infection. Another risk factor is diabetes, high estrogen levels, using contraceptives such as IUD, diaphragm, and sponges. The typical discharge in candidosis, in candidiasis, is the thick cottage cheese. You know, the cottage cheese like discharge is very thick, it's white, and usually is not associated with any smell, any odor. Not always will you have discharge in vaginal candidiasis, let me just say that. And now the most common symptoms, the other associated symptoms apart from the discharge, they will be itching. It's very common in Candida, almost always there. And you may also experience some burning and some irritation and pain during urination or during sex. The treatment, so you have to get antifungal medications, and you always have to go to the hospital if you have vaginal candidiasis. It's recommended that you go to see your healthcare professional, maybe not in the hospital, but at the clinic. Yeah. Another cause is what we call Trichomonas vaginalis. This is an STI. It's different from the yeast infection and the bacterial vaginosis, which are not STDs, but this one is an STI, and it's so much associated, very much associated with vaginal discharge. And the discharge is typically yellowish green and sometimes frothy and can have a foul smell. The symptoms again are burning, itching, and pain when urinating or painful intercourse, and usually just treated by one-time dose of antibiotics. And then the fourth cause, chlamydia and gonorrhea. These are two different infections. It can cause vaginal discharge, although more often than not, these infections do not have symptoms. In chlamydia, the discharge is pus-filled, and 80% of cases of chlamydia do not have any discharge. And as for gonorrhea, it can also cause like pus-filled infection discharge, but it's asymptomatic in about 50% of cases. If it's accompanied by a pelvic pain, it's suggestive of PID, pelvic inflammatory disease. This means the disease has gone up, you know, through the vagina into the cervix, inside the uterus, and to the tubes, and it has now caused inflammation in the tubes or even outside, which can lead later on to blockage of the tubes and infertility. So you really have to get whatever it is. If you see any abnormal discharge, go ahead and see your healthcare professional, get treated as early as possible. And another thing that I forgot to mention is foreign objects. Foreign objects can cause a chronic vaginal discharge with a foul smell. Foreign objects, I'm talking about stuff such as toilet paper stuck in there, or tampons, or even some of objects used for sexual pleasure, which are known as toys and stuff like that. So I hope that this video was very useful to you, and it's really just for you to know what is normal and what is not normal, to get an idea of what's normal and what's not normal, so that you know when to see your healthcare provider and when to stay home and relax, because there is nothing happening. So I hope it was useful.